Welcome back learners. This is Akanksha Singh Gautam and we have met in our last lecture wearable sensors and devices. For today, I am excited to introduce a topic that's shaping the future of healthcare, the Internet of Things, often known as IoT in health. So, let's see, by the end of this session, you will have a comprehensive understanding of what IoT in healthcare entails, its various applications, the benefit it offers as well as the challenges it presents. Okay. Before getting into IoT in healthcare, let's simply understand what actually IoT means. The Internet of Things, often abbreviated as IoT, is revolutionizing technological concept that has been transforming the way we interact with the world around us. At its core, IoT refers to the network of interconnected physical devices, objects and systems that are embedded with sensors, software and other technologies to collect and exchange data. This network enables these objects to communicate and collaborate, often without direct human interventions, to perform various tasks and provide valuable insights. Now, we will see how IoT works. Data collection. IoT devices continuously collect data from their environment using embedded sensors. For instance, a smart thermostat might collect temperature and humidity data from a room. Next is data transmission. The collected data is transmitted to a centralized system, often through the internet. This can be a cloud-based platform where the data is stored and processed. The next is data processing and analysis. Once the data reaches the cloud, it undergoes processing and analysis using algorithms and machine learning techniques. This analysis can reveal patterns, trends and anomalies. Decision making. Based on the analysis, decision can be made in real time. For example, a smart ignition system might adjust water flow based on soil moisture data received from the sensor. The next is feedback and interactions. IoT devices can provide feedback to users or other devices. This can include notification, alerts or automated actions based on certain conditions. As we have seen how IoT works, now we will see some example of IoT applications. The basic example you will find in smart homes. Smart thermostat, lights, security camera and appliances that can be controlled remotely from increased convenience through efficiency and security. Next, we can find use in healthcare. Wearable fitness trackers, remote patient monitoring devices and smart medical equipment that enable better healthcare management and early intervention. The next is industrial IoT. Sensors and data analytics used in factories and industries to optimize processes, reduce downtime and improve efficiency. The next application will be in agriculture. IoT enabled sensors to monitor soil condition, weather and crop health, leading to more precise and sustainable farming practices. The next application you can find in transportation. Connected vehicles and traffic management system that enhances road safety, reduce congestion and improve overall transportation efficiency. The next is in smart cities. IoT technology can be used to manage urban infrastructure, monitor pollution level, optimize waste management and enhance overall quality of life. Now, as we have seen IoT in general, we will now see how IoT works in healthcare. IoT in healthcare refers to the integration of interconnected devices, sensors and data analytics in the healthcare sector to enhance patient care and outcomes. This involves a network of smart devices that gather and exchange data contributing to improved healthcare services. So, let us break down the key concepts of IoT in healthcare. The first we are going to see is sensors and devices. Imagine a world where medical equipment and everyday devices becomes intelligent, capable of sensing and collecting data in real time. This is the essence of the first component, sensor and devices. Types of sensor. These remarkable devices can range from simple temperature and blood pressure sensors to more complex ECG monitor, glucose monitor and pulse oximeter. They can be wearable, implantable or attached to medical equipment. The next is data collection. Sensors continuously gather information such as vital signs, patient movement and environmental condition. For instance, wearable fitness trackers monitor heart rate, steps taken and sleep patterns. We will see now diagnostic insights. The data collected offers healthcare providers invaluable insights into patient health and behavior, enabling timely interventions and personalized treatment. The next is connectivity. In the era of IoT, connectivity is the lifeblood that empowers devices to communicate and share data seamlessly. The second component, connectivity, facilitates the exchange of information across the healthcare ecosystem. In this, we can see first one will be wireless communication. IoT devices uses various wireless technologies like Wi-Fi, Bluetooth, cellular networks to transmit data. This allows for real-time data transfer and remote access to information. Next is data transmission. Connected devices transmit data to centralized database or cloud platforms, where it is stored securely and made accessible to authorized healthcare professionals. The next is interoperability. Ensuring that different devices and systems can communicate effectively is a challenge. Standardizing protocols and ensuring compatibility are crucial for successful IoT implementation. Now, next we will see data storage and analysis. The influx of data generated by IoT devices is immense. This leads us to the third component, data storage and analysis, where technology steps in to make sense of this data deluge. Cloud-based platforms. IoT generated data is often stored on cloud-based platforms that offers scalability, accessibility and security. These platforms enable healthcare providers to store and analyze vast amount of data. The next is data analytics. Advanced algorithms and machine learning process are employed to analyze the collected data. This analysis unveils patterns, trends and correlations that guide clinical decisions and treatment strategies. The next in this segment is predictive modeling. IoT data analytics can be harnessed for predictive modeling, allowing healthcare professionals to anticipate disease outbreaks, track patient progress and optimize resource allocation. The next is user interface. While the technological intricacies are essential, user interface serve as the bridge between technology and healthcare professionals or patients. The fourth component, user interface, enhance accessibility and usability. In this, the first one is patient engagement. Interfaces like mobile apps, web portals empower patients to assess their health data, set health goals and communicate with healthcare providers, fostering active patient participation. The next in this category is healthcare providers. For healthcare professionals, user interface provide real-time patient data, remote monitoring capabilities and tools for streamlined communication and coordination. The next will be alert and notification. These interfaces delivers timely alerts, reminders and notification based on analyzed data, ensuring prompt interventions in critical situations. Okay, now we will see the next segment. In healthcare, the Internet of Things IoT manifests in various forms, each tailored to address specific needs and challenges within the industry. Here are some prominent types of IoT application in healthcare. The first type is wearable health devices. These are perhaps the most recognizable IoT devices in healthcare. Wearable devices such as smartwatches, fitness tracker and even smart clothing are equipped with sensors to monitor vital signs, activity levels, sleep patterns and more. They provide individuals with real-time health data and promote proactive approach to personal well-being. The next type is remote patient monitoring. IoT-enabled devices allow healthcare professionals to remotely monitor patients' health conditions and collect real-time data without requiring them to be physically present in a healthcare facility. It is particularly beneficial for managing chronic conditions, post-operative care and elderly patients. The next type is smart medical devices. These devices incorporate IoT technology to enhance their functionality and connectivity. Examples include smart insulin pumps that adjust insulin delivery based on blood glucose levels, smart inhalers that track medications usage and provide reminders, and pacemakers that transmit data to healthcare providers. Next is telemedicine and virtual care. IoT plays a crucial role in telemedicine and virtual care. By enabling remote consultation, diagnosis and treatment, IoT connected video conferencing tools, diagnostic devices and wearable sensors facilitate virtual interactions between patients and healthcare providers. Next, we will see IoT enhanced surgery. IoT is transforming surgical procedures through augmented reality, often known as AR, virtual reality, often known as VR, and real-time data sharing. Surgeons can use IoT connected tools to visualize patient data during surgery, enhancing precision and decision making. Next type we will see health monitoring platforms. These platforms integrate data from various sources including wearable and medical devices to provide a holistic view of a patient's health. Healthcare professionals can access centralized dashboard to monitor patient data and detect anomalies. Next is smart hospital and healthcare facilities. IoT transforms hospital operations by optimizing resource allocation, patient flow, and asset management. IoT connected devices track equipment storage, manage inventories, and even monitor patient queues to improve overall efficiency. Pharmacy and medication management. IoT technologies are used to manage medications, dispensing and adherence. Smart pill dispensers send reminder and track medication usage, reducing the risk of missed dose. The next type will be home health monitoring. IoT extends healthcare beyond the hospital walls. Patient can use IoT devices to monitor their health at home, and the data can be shared with healthcare providers for remote monitoring and interventions. The next type is health and wellness app. IoT powered mobile apps provide users with personalized health recommendations, reminder for medications, and tools for tracking diet and exercises. IoT in clinical trials and research. IoT devices are employed in clinical trials to collect real-time patient data, ensuring accurate and up-to-date information for researchers and reducing the need for frequent patient visits. Next, we will see IoT in elderly care. IoT devices can enhance the quality of life for elderly by providing remote monitoring, false detection, and alert systems to ensure their safety and well-being. Now, as we have seen all basic types of IoT which is used in healthcare, we will go to our next segment. The integration of Internet of Things in healthcare has brought forth a multitude of benefits that are transforming the industry in profound ways. These advantages encompasses enhanced patient care, streamlined operations, and improved outcomes. Let's delve into key benefits of IoT in healthcare. The first one is personalized medicine. IoT facilitates the collection of personalized patient data, allowing healthcare professionals to tailor treatments and interventions to individual needs. By analyzing data from wearable and sensors, doctor can develop targeted treatment plans that consider a patient's unique health profile. The next is data-driven decision making. The wealth of data generated by IoT devices empowers healthcare providers to make informed decisions. Data analytics reveal patterns, trends, and correlations that guide diagnosis, treatment planning, and predictive modeling, enhancing the accuracy of medical interventions. The next we can see is chronic disease management. IoT devices play a pivotal role in managing chronic diseases such as diabetes, heart diseases, and respiratory conditions. Continuous monitoring and data analysis enable proactive management, reducing the risk of complications and improving patient's quality of life. The next is efficient health operations. IoT optimizes hospital operation by automating routine tasks, monitoring equipment usage and enhancing resource allocations. This leads to improved patient flow, reduced waiting times and better utilization of healthcare resources. Now, we will see improved patient engagement. Patients are empowered to actively participate in their health care through IoT devices. Wearable and mobile apps encourages self-monitoring, allowing patients to track their progress, set health goals and make informed lifestyle choices. Next, we will see enhanced medication management. IoT-enabled smart pill dispenser and medications tracking system helps patient adhere to prescribed medication regime. These devices provide reminders, track usage and notify patients and caregivers if doses are missed. The next is real-time health monitoring. IoT devices offer continuous real-time monitoring of patients' vital signs and health metrics. This real-time data enables rapid response to critical situations and reduces the risk of medical emergencies. The next is early disease detection. IoT devices can identify subtle changes in patients' health patterns that might indicate the onset of a disease or deterioration in their condition. Early detection allows for timely intervention and better treatment outcomes. The next is telemedicine and remote consultation. IoT powered telemedicine platforms enables remote consultation between patients and healthcare providers. This is especially valuable for patients in remote areas, those with limited mobility and during time of crisis. The next is health data analytics. The aggregated health data from IoT devices contributes to large-scale health data analytics, enabling researchers and public health officials to track diseases, trend, plan intervention and improve population health. The next in this category is reduce healthcare cost. Through efficient resource utilization, reduced hospital readmissions and preventative care enabled by IoT, healthcare cost can be lowered both for patients and healthcare system. In essence, IoT in healthcare transcends traditional boundaries, forging a new era of patient-centric care and optimized healthcare operation. Now, as we have seen the benefit of using IoT, now we will go to our next segment. The implementation of Internet of Things in healthcare offers numerous benefits, but it also comes with a set of challenges that needs to be carefully addressed. These challenges span technical, ethical, regulatory and security aspects. Let's explore the key challenges associated with IoT in healthcare. The first concern will be privacy and security concerns. Protecting sensitive patient data is paramount, yet the interconnected nature of IoT devices increases the risk of data breaches and unauthorized access. Health records, vital signs and personal information transmitted between devices can be vulnerable to cyber attacks, compromising patient confidentiality. The next concern will be data integrity and accuracy. Ensuring the accuracy and integrity of data collected by IoT devices is crucial for making informed medical decisions. Malfunctioning sensor, signal interference, or errors during data transmission could lead to inaccurate readings and potentially harm patients. The next concern is interoperability issues. IoT devices come from various manufacturers and may use different communication protocols, making seamless integration and communication between devices and systems a challenge. This lack of interoperability can hinder data sharing and lead to fragmented patient information. The next concern is ethical dilemma. IoT raises ethical questions about data ownership, consent, and patient autonomy. Determining who owns the data generated by IoT devices, how it can be used, and ensuring patients have control over their own health data are complex ethical consideration. The next one is regulatory compliances. The healthcare industry is heavily regulated to ensure patient safety and data privacy. Integrating IoT devices into this regulated environment requires adherence to existing regulation and standards, as well as the development of new guidelines to address IoT specific challenges. The next concern is data overload and management. The sheer volume of data generated by IoT devices can be overwhelming for healthcare providers. Efficient data storage, analysis, and interpretations are crucial to extract meaningful insights from the data deluge. The next concern is healthcare workforce training. Healthcare professionals need to be trained to effectively use and interpret data from IoT devices. This involves understanding the technology, data analysis, and integrating IoT generated insights into clinical decision making. The next is reliability and dependability. IoT devices must function reliably and consistently to ensure patient safety. Any malfunction or downtime can impact patient care and leads to potential health risk. The next concern will be patient trust and acceptance. Convincing patients to embrace IoT devices for health monitoring and management requires building trust in the technology's reliability, data security, and ethical use. Some patients may be reluctant to share their health data with IoT devices due to privacy concern. The next one will be cost and implementation. The initial investment, installation, and maintenance cost associated with IoT devices and infrastructure can be substantial. Healthcare organizations need to weigh their cost against the potential benefits. The next one is data governance and ownership. Determining who has access to IoT generated health data, how it can be used, and how long it should be retained requires clear data governance and ownership policies. Next one is network reliability. IoT devices rely on network connectivity to transmit data. Network outrages, poor connections, or technical glitches can disrupt data transmission and impact patient care. Now, we will see the future of IoT in healthcare sector. The future of IoT in healthcare is poised to be a dynamic landscape of innovation, technological advancement, and transformative changes that will further reshape the way healthcare is delivered and experienced. As technology continues to evolve, several key trends are expected to emerge in the realm of IoT in healthcare. Now, let's recap what we have learned so far. I will ask two questions, try to answer it. The first one is, which of the following is an example of an application of IoT in healthcare. Your options are smart home automation, online shopping, remote patient monitoring, and the D is social media networking. The correct answer will be C, remote patient monitoring, as it involves using IoT to monitor and track patients' health remotely. I will ask another question. What are some challenges associated with implementing IoT in healthcare? The first option A is limited data storage capacity, B lack of skilled workforce, C privacy and security concerns, and D high implementation cost. The correct answer will be privacy and security concerns, as these are significant challenges when it comes to implementing IoT in healthcare. As the technology continues to evolve, the future of IoT in healthcare holds even more exciting possibilities, including AI-driven diagnostic, personalized medicine, and improved disease prevention. In conclusion, the Internet of Things is transforming healthcare by connecting devices, data, and people to enhance patient care, optimizes operations, and drive innovations. It's imperative that healthcare professionals stay informed about these technological advancements to ensure the delivery of quality patient care in the digital age. I thank you for your attention during this lecture. We will meet in our next lecture on artificial intelligence and machine learning in biomedical instrumentation and sensor. Thank you very much.